Welcome to Medsupa Revision Initiative. This is a program that has been brought for you just to facilitate your studying, to facilitate your revision. Okay, so this is a health system management revision pack, and today's session we are looking at delegation, and all the members are most welcome. All those who would want to join, just subscribe. Okay, and it's designed very well to ensure that when you are preparing your intermediate examination as a clinical officer student, you have to ensure that you are actually set and you are receiving relevant information, standard guidelines on the must know of health system management. Okay, we can begin. So today's session we are looking at delegation. So what is delegation? What comes in your mind when we talk about delegation? That is very, very important. Let's begin. Always we have to remember that the sayings of the wise, Sir William Osler, a very renowned physician, okay, he has left legacy. Okay, so he said to study the phenomena of disease without books is to sail uncharted sea. To study books without patience, not to go to sea at all. To study books here is not to go to sea at all. So even as we are studying, sometimes you may have a lot of good materials. If these materials were unable to link to your relevant profession, then it is very difficult for you to apply. For example, you are doing health system management and you do not understand the health systems. You do not understand the governance systems. So it will be very difficult. But by joining to this program, we provide you why you are doing the management, why how you are going to apply delegation in your clinical practice, and it becomes consolidated that by using the principles, the theories of management and leadership and integrating them to health practice. By having these two, then the study becomes enjoyable. Okay, let's begin. Definition. What is delegation? Okay. What is delegation? So delegation, when it comes to application to life, sometimes as in the aspect of health, we also apply to medicine and also to life. So delegation, even in life, delegation is there. Okay, and so many practical examples that can say for us just to understand when we're talking about delegation. For example, we may look at delegation. Maybe you are at home. Okay, so you have a young sister and you work. Okay, and you have got all duties that's supposed to carry at home. Then you just tell a daughter, okay, I think you can go to the market, buy some vegetables, and then you can also say, okay, I'm going to do this. But I'm sure even as you are sharing the duties at home, you also plan. You don't just wake up, you say, okay, I will tell my daughter to go and to the market and not know what needs to be done. And of course, you're going to find that even as that's done in life, day-to-day life, you find that it's not everything that you are able to task to your daughter, okay? And you are going to say, okay, depending on the norms and the values, to say, okay, I think she cannot do this. For example, washing, okay? I'm sure you cannot give a daughter to wash everything that you're able to wash, even for your husband. So when you think about delegation, it's a very good topic and a very important aspect in application, both to life and to medicine. Okay, so that's delegation. So you are just trying to share your responsibilities, okay, to another person. Okay, now let's begin now. Delegation. The first definition is a process of assigning part of your job with authority and responsibility to immediate subordinate. Okay, that's a definition. Okay, so it's a process. So it's not a once-off thing. It's a continuum which is meant for mentorship, for developing, for staff development. Okay. Now, we can also say it's a process of directing another team member to perform clinical tasks and activities on your behalf. That is now in the clinical setup, in the hospital setup. Okay. We can also define as a transfer of responsibility to a person who is competent to complete a task. That is very important. Very good definition. So as you are trying to assign, you don't just assign to everybody, to anybody. You assign to a person the responsibility, one who has been assessed to be competent to complete a task. That's a very definitive delegation. Okay. Now, a manager delegates when he deliberately chooses to give a subordinate authority to carry out a piece of work which the manager could have to keep or carry out himself. That's very, very important. So simply means that we do not delegate everything. We don't delegate with total authority. We share the authority. That's very, very important. We do not give everything. It's piece of your work. That is very important. Okay. As we progress further in our discussion, we'll learn a lot. And then, what else are we supposed to see there? We're going to find that actually a leader, the leader of a team is responsible for the work the team undertakes. That is very, very important also. You are accountable. You are responsible. Okay. Very much responsible. So, when we talk about responsible, what does it simply mean? What are we talking about? Responsible simply means that that's the obligation to perform duty. So the obligation to perform duty, you are responsible. Okay? Whatever you are giving the subordinates, you are responsible. All right. When you delegate, you give official authority, which is the right you give for your subordinates to perform. You delegate to perform. You have to give the responsibility to perform the when you delegate, it means you give. You can put a comma here. Okay. When you delegate, you give the responsibility to perform a task. That's very important. Now, clinicians, even if you are delegating, clinicians, you still remain accountable for all clinical care provided. That is what we mean here. As a leader, you're responsible for the work that the team undertake or the subordinates. And you must follow the guidelines for effective delegation and know which aspect can never be delegated. Okay? The clinician does not allow enough time for adequate supervision of those to whom tasks are delegated. Now, what it means here, when you are delegating, you have also to understand the scope of practice to people you are delegating to. As we progress, and this is what we're going to discuss here. You are a clinical officer, for example, you are a medical doctor, you are a medical licentiate. You may look at whom are you going to delegate? What's the scope of practice? Okay, that is what it means. Someone who is competent to complete your task. All right. Delegation also creates accountability, meaning that those charged with responsibility are responsible for the results. And that's the reason why you have to ensure that you have to make follow-ups. You need to look at what they're doing. Do they need assistance? Okay. Yes. But remember, delegation is not dumping your work to others. Okay. You're just sharing the task. Thing that you'd want to be done so that you achieve the organization's goal. Now, delegation, it has elements which we call the anatomy of delegation. Okay, what are those that actually forms up the anatomy of delegation? Number one, we are calling it ARA. Okay, so we have A, that is authority. So when we talk about authority, that's a power or right to give orders. So those are the elements or the anatomy, the anatomical aspect of delegation. So we have authority, and authority, that is a power, okay, and or the right to give orders. Then we have responsibility, okay. So responsibility, that's the obligation to perform what? Duty. So all that is an element. And the last one is accountability. So accountability simply means answering for job outcomes, okay, or outcomes of your job. So it is very important to remember the three elements of delegation, so that whenever you are trying to delegate, you have to remember that actually this delegation I'm talking about, me who is delegating, okay, and the scope of practice will tell me who should I delegate, because sometimes you may end up delegating your consultant, you may end up delegating your senior, so you need to know who to delegate to, and that it is governed by the elements of delegation. You need to look at authority. What's the authority? What's the responsibility? What is your accountability? Okay, so that you are able to share what you'd want to task your subordinate. Okay, hope this is clear. And if you have a question, please just type or raise up the hand and ask. Now, what's the purpose of delegation? What's the purpose of delegation? Okay. Why should delegation be there? It frees up clinicians, healthcare providers, to care for critical patients and complete other tasks. So, for example, you know that comprehensive care of a patient begins from taking the vitals, okay, because you can take the vital, okay, or a nurse can take a phyto, or even you can take a phyto. So you have to free up, so that you are able to look at performing critical critical patients, specific things that requires much of your attention. And at the end, all those tasks that you have shared to subordinates, okay, with the other task that you are performing, together it actually become achieved. It is been achieved timely, okay, and that will help your facility, our organization to attain the aimed goals that have been set. So it frees, you are too busy, you have to look at the vitals, and you have so many, and you have got patients who are needed, patients who need special care, special attention, and you want to do everything. You may find that you may not manage actually to complete everything. It also reduces stress. Okay, so sharing the tasks also helps. So even as you are freeing up, you clinicians for in the clinical service for clinical patients, you are also trying to do staff development. Try to motivate your subordinates to see also, to appreciate, to say, we are also considered, we are also appreciated, and at the end, remember, we are dealing with the leadership and management in healthcare. Then we are coming up with teamwork. Okay, so we are trying to apply what we are calling the multi-cratic kind of leadership. Okay, so the multi-cratic kind of leadership, it is interdisciplinary, it is a teamwork, and that's what is more appropriate in healthcare setup. Okay, so that's the purpose. So it frees up. So I'm sure you are able to understand that at least you give out certain things to help you. So they help you to complete those tasks that you're supposed to carry out as you are also performing the other work. Okay. What are the components of delegations? Okay. Number one, delegation involves two persons. So there should be a delegator and the delegatee. So who is a delegator? Okay. A delegator now, it's you who is sharing the task. The delegatee, it's your subordinate, the one that you want to share your task. That is very important. The delegator must be aware of the personal strength, that is very important, and the weakness, capability of your subordinates. Okay. So when you are delegating, you cannot just pick anyone. Okay? You need to look at the attitude. You need to look at what are their strengths in terms of training, in terms of skills, in terms of experience. Okay? You cannot pick a semester 1 clinical officer student, okay, who has just reported to say, okay, I want you to cannulate. Okay, cannulate all these patients in this ward. After that, you can also do catheterization, and yet they've just come to learn and they are learning, So those are inappropriate for delegation. So you need to know. That's all. You have to be aware of who am I delegating. Okay, what's their scope of practice? And if it's part of the medicine, you can also check. You need to be very cognizant with the scope of practice. Okay, if you are dealing with, you want to task a clinical officer, you want to task which area, a medicalization, a medical doctor, a clinical anesthetist, or anesthesiologist. Okay, you need to look at the scope of practice. Okay, are they able to do what I want them to do? Is it within there? scope of practice. Okay, because you cannot assign someone who does not have a scope of practice. Then it means he will not attain your task. It may not be done as desired. So that is very, very important to take note. Okay, now we've defined what delegation is. We are transferring the responsibility to a person who is very competent to complete the task. Now, we need to know what delegation is and what delegation is not. So, what delegation is, for you to say you are delegating, first, it's a two-way relationship. You're supposed to be a delegator and a delegatee. Secondly, you have to give authority to subordinates. Now, listen carefully. You share authority. That should be understood. It's not total authority. You share the authority. Part of the task that you want is why you share that authority to that particular aspect, to that subordinate. The third point is letting subordinates to take decisions. Okay, so you've given them responsibility, so let them take decisions on how they are going to meet that desired result, how they are going to attain it as you have assigned them. Okay, that's very important. Letting subordinates to use personal initiative. Okay, so as long as this is the reason why you have to explain to them what really do you want to attain, what is it all about, how do you want it to be done, when do you really want it, and then they'll come up with their initiative. Okay, so for example, they will try to explain to say, okay, I think for me to attain these results, I'm going to do A, B, C, D. So you have to let subordinate. You don't need to underlet them. Whatever initiative they come up, facilitate, and actually you see things being done. Permitting subordinates to control their own work environment. That's very important. That's delegation. Okay, so you permit, all right, to control their own work. Environment, and they'll be motivated. They'll be very happy. Okay, there are even those who are aiming to say, I also want to be the in charge. I want to be the senior clinical officer. I want to be the district health director. I want to be the clinical care officer. So they are always in that desire of being a leader. And the moment you give them that responsibility, the moment you give them that opportunity, they are very happy. So permit them, and now they would want to say, I can work. And it also brings the teamwork, because some actually are working in isolation. Okay, they just come, report, screen, finish, do the word round, off they go. And when you give them now these extra responsibilities, actually it embraces teamwork, and you are modeling them, you are developing them. That is delegation. Encouraging initiative and teamwork is very key. You force to encourage, show them that you can actually also do something. There's something in you that you can do. Welcome the ideas, welcome their proposals, hear from them, respect their views. Okay, and they will be very happy. That is, you are a good delegator. Okay, and that's what delegating. So encouragement is very important. Okay, you don't need to embarrass. Where were you trained? Look at you. Where have you heard you can screen like that? You have to encourage, and that brings motivation. Giving coaching is very key and instrumental in the aspect of delegation. because these are new people and you want them to know something in the way you'd want things to go. So coaching is very key. And nobody was born there and then can do a cesarean section and knows how to go about that, can know how to handle complications, ruptured uterus. But by coaching, encouraging them, this is how you go about it, yeah? Books, the diseases don't read disease, books actually, you tell them, you show them how they approach what's there, between the line of a sentence of a book and what's in the clinical practice and what have you, your experience has been. So you keep on coaching and ensure that actually at the end of the day you begin to trust them, okay? Because when you're coaching them, you are even now becoming full aware of who is very good in ophthalmology, who is very good in IMED, who is very good at surgery, and so forth. So coaching is very important, okay? And this is delegation. Now, what delegation is not? Okay, number one, it's not the relationship from higher to lower management. Okay, so this is very, very important to know. Okay, this is not delegation. Okay, something we do only once is not delegation. Delegation is a process. Delegation is a continuum. It's a continuous. Okay. Using authority, taking decision for subordinate, it is not delegation. Distributing workloads only, not at all. It's not. Just distribute. Whatever you do, it's up to you. No, you have to have a draw line. What do you want to achieve? What is it that you want to share? Okay, start distributing. You do this, you do this, you do this, and you are there listening, chatting, going and do other things because you have distributed what you're supposed to do on that particular day. That's not delegation. Delegation, you are sharing out part of your work for someone to do on your behalf. Okay. Controlling subordinates and their way of working, that's not. Remember, we said you have actually to encourage, you have to provide courtship, you have to let them use their own initiative. Okay, so controlling subordinates and their way of working, that's not delegation. Passing one's responsibility to others, no, that's not delegation. Okay, that is very important. Passing directions, no. That's not delegation. So, when you are writing the exam, you should always remember that not dumping your work to someone. No, that's not delegation. You don't dump, okay? And you don't want to work, you just give everyone, this one I'll give you, you are going to be the one who's going to be analyzing, you are going to check on these policies, you are going to analyze this, and off you go. That's not delegating. Alright, then there's something that I need to remember is step. Okay, so you should remember something like step. Okay, you should remember something like step. So tape, it is something that you have to consider whenever you want to delegate. So number one, we're talking about teaching. That's why you need to make someone understand. Certain roles that you want to do, they require added training, okay, added courtship. So you have to teach, okay. And You have to assess to see if what you have taught, what you have trained, someone has gained, someone has understood, is able to do it. All right. Then you have to do what? To plan. What exactly do you want to delegate? In the last E, you have to ensure that it's evaluating. So delegation is not just a 1, 2, 3, 4. Delegation is a process. Delegation requires you to ensure that you are planning to look at what are roles. That's why it's very important that whenever you are reporting for work, you're studying. Tomorrow you become a graduate, you become a practitioner, a clinician. You have to ensure that you've got even a diary. A diary is a record of daily activities, so that to be able to balance what you are planning and what are you trying to achieve on a daily basis. And that becomes very easy for you to delegate. But if you do not plan, you do not know what you're supposed to do on a Monday, what's supposed to do this month, what you need to achieve, when should you achieve, and you just go for work. Okay, now it's time for knocking, you knock off. You don't know what you're supposed to do, what should be your measurement, what should be your parameters that's supposed to work on, and that becomes very, very difficult to delegate. Right? Hope you are understanding, hope you are following. Okay, now tasks that you should not that should be delegated. What are those things? Generally, that at least these are the things that you're supposed to delegate. Number one, the routine tasks. Okay, so routine tasks should be delegated, are delegatable, and tasks that which consume a lot of your time. That's very, very important, so that it frees you up. So if you find these are the things that consumes much of my time, you can share so that you concentrate on those that demands you most. Because on your plan, you have got some priorities, and priorities are also looking at huge tasks that's supposed to carry out, and that only requires your specialty, requires your experience, your skills, your knowledge, and those are the things that you're supposed to concentrate much on. And those things that you see that they are actually consuming your time, you are able to do what? To share. Now, tasks that should not be delegated, that you should not delegate. Okay. Number one, your accountability. Accountability, what do we say? Accountability is answering for outcomes of your job. So accountability, is very key, very important. That one, in the right to report to one supervisor, okay, or one that's supervising, that should not be delegated. Discipline also. The power to discipline workers lies with you, because sometimes when you delegate, you do not know how these relate to each other. Sometimes maybe, after all, this is what this one has been doing for me. Since now I've been conferred this power, let me dismiss this worker. So you may find all those are dismissed, and you find new workers have joined just for the time that you went out. In a week, in a month, you find everything has changed because discipline. So that lies within your anatomy of delegation. It should not be delegated. Okay. Importance of delegation. That is very important. Okay. And most in the exam, they like asking this question. Sometimes it can come, what are the benefits of delegation? Sometimes it can come as, why is it necessary to delegate? So number one, it saves you time to do other duties and look ahead. That is one importance of delegation. Number two, the function that you have delegated gets individual and constant attention, meaning that it will be done very well, meaning that this individual will do it very well constantly on that. Hence, there's efficiency in your duties, efficiency in the organization, in the health facility. The third one is speeds up decision making. Okay, because now initiatives, okay, like there's this philosophical saying, alone I can run very fast, together we can reach very far. So you find that it speeds up decision making because you are sharing. It also provides a form of on-job training. This is very important. Okay, because they will be asking, and at the end they are perfecting, and this is what have. So you have to ensure that you leave legacy, train people, show them. Okay, that's your responsibility, and it's a motivating factor. Someone will feel happy. I'm also considered. I'm also counted. All right. Wow. Yeah, I'm also a clinician. Wow, I'm given this responsibility. Today I've been how the in charge left me. I'm the acting in charge, and they'll feel good and they work very good because actually some of them they have been admiring. Say when one day I'll become the in charge and I'll deliver, proficiently, effectively, efficiently, and it becomes a motivating factor. It facilitates also staff development because as you keep on delegating these, actually you are developing them in various sets of skills. Okay, it causes subordination to accept responsibility because of staff development. They have known what to do, they are competent, they know they can handle clinical duties, they will really accept responsibility. But if this is lacking, actually everyone will be refusing to say, who wants to be imbalanced at the end of the day? No, everyone will be pointing to me at this one failed to cannulate, for example. Okay, like you may find that maybe in a hospital setup, adults they are very good at cannulating. Children, everyone is running away. You cannot delegate because no, you have received an emergency. Oh, can you attend to pediatric ward and do the cannulations? Everyone will be no, I'm not good. I'm not mentored. I've not been given that chance. He's the only one. He's the only one who does that. So we don't know. Nobody knows. So once this is happening, like staff development, job on training, you find that actually it causes them to accept responsibility. So that is a very very important to take note. Okay, it keeps things going when you are not around. There are some situations, you are not at the hospital, then nothing works. Everyone will be waiting for you. So you're coming, you find a queue, and you are feeling good. Now, that's not being a good leader, not a good manager, right? So as a good manager, a clinical manager, you have to ensure even if you're not there, things keeps on going. Then you're a good manager, right? It helps to give you the satisfying experience of watching your subordinates develop. You feel very good to say, wow, this was my student. Now my student can completely attend to me, attend to my family, and I'll be very happy. Oh, you're not feeling well. Let me go. I have one of the students that I once mentored. That's why for me, my motto is today you are my student, tomorrow we are colleagues. This is where it comes from. So we have to ensure that we feel good seeing you doing competently, seeing you, conducting labor very well, seeing you doing cesarean section very well, making a very good diagnosis, giving a very good, precise, rational prescription, undertaking very good posological, tactics. It feels good. So it helps you, satisfying experience of watching a subordinate develop. You feel good. How do you feel seeing a subordinate doing a very good work? You feel happy, and that means they are a very good manager. Okay. Aspects of effective delegations. Okay, so what's supposed to know? Knowing when not to delegate is very, very important. Okay, so you have to know when you are not to delegate and when you have to delegate. Identifying to whom to delegate. These are very key areas because you cannot just delegate to anybody. All right. And trusting subordinates is very difficult. It takes time for you to trust them. Matching the task to the person to whom it is delegated. This has to do with the scope of practice. Okay, so the scope of practice is very, very, very key. So that's what you have to look at, matching the task to the person to whom it's delegated. Okay, because you may give, for example, someone junior to say, okay, you are the one who's going to undertake the emergency cesarean section that they have called, they are bringing the ambulances on their way, and yet someone in the school of practice is unable to do cesarean section. So, it's very difficult. So those are the aspects of effective delegation. Supervising delegated tasks. Okay, so that is very important because that gives you an opportunity to identify where assistance may be needed. 5 rights of successive delegation. Okay, the 5 rights. These are very, very must know for any student doing leadership and management. Number 1 is the right task. Okay, so the right task, what are you trying to do here? You determine what to be delegated. Okay, so determine what to delegate. So you find that delegation actually begins with what? The manager. You have to define your responsibilities. You need to know what are your responsibilities. So you have to remember the anatomy. Okay, the elements of delegation, which we talked about: authority, responsibility, and what? Accountability. So that is very, very important. So you have to list that. And what you're trying to come up with is to know what we can call a secondary list. So a secondary list, we're talking about coming up with 2 secondary lists: a list on things that you cannot delegate and a list on things that you are able to delegate. And those things that you are able to delegate, how do you know? Those are the things that actually that others can do or help to complete the task. Okay, so those are the ones that are favoring you to delegate. But things that you can only do alone, it's only you that you should do, those actually are not things that you can delegate, like accountability, as we talked about, discipline, those you cannot delegate. But things that others can do or help complete the task, those are the things actually that are giving you opportunity to delegate. So that's the right task. The second right is the right circumstance. That's very important. So the right circumstance, now you're coming up with the reason why you are delegating. And the reason must be genuine, okay? Such as to train, to motivate, subordinate, to reduce the workload, and promote efficiency. Okay, so meaning that you cannot just delegate your duties for wrong reasons or circumstances, like I know I've worked too much, I don't want to work. And that's not just for wanting to work, just want to have laissez-faire, just to do other things, and because there's delegation. So it's supposed to be the right circumstance. Okay, the third right is the right person. That is very important. Choosing the right person to delegate the task. Okay, because don't just choose anybody. So you as a manager must ensure you select the right person, the right subordinate to do the job. All right, taking into consideration on one, the knowledge that the subordinate has, the skills, the attitude, the experience, and the what? The position that the subordinate has. That's very, very, very important. Okay. So don't just choose any person. Maybe the person you are choosing is a DDO, you know? You know DDOs sometimes they are called day drunkard officers. So he's ever drunk. So what is he going to do? You may find that actually your work will suffer. Right. The fourth right is the right direction, all right, and communication. So what happens here now is that you are clarifying actually the desired result. Okay, so when you classify the desired result, it is giving you a right direction, even to a person that you want to share the task. So meaning that the results expected to be achieved must be clearly explained to the subordinate. Okay. And when the results are clear, it allows the subordinate now to use his own or her own what? Initiative on how to accomplish. So meaning that the subordinate may come up with creativity, you know, his own creativity or resources to accomplish the task, and that will make your work very easy. Then there's also added advantage, you know, added benefit of effective delegation. You know, when we talk about effective delegation, we mean that you have been coaching, you have been performing staff development, you have been doing job on training. Simply means that actually it may find a better and more effective way to accomplish the task or achieve the desired result, because this individual may come up with initiative, you know, on how best can attain those tasks that have been shared. So that is the right direction. All right. The fifth right is the right supervision and evaluation. Okay. Meaning that monitoring progress. Here you are monitoring the progress. So what are you doing? Okay. This can be achieved by conducting follow-up meetings. And these meetings, actually, follow-up meetings, should be focused on monitoring what? The progress and determining need for assistance. Okay. And the number of follow-ups may vary depending on the task given and or the project that needs to be achieved. Okay. In the department or in the hospital. So that's how you have to know what's supposed to know in the 5 rights. So it's very important to know the 5 rights, because they will guide you as we'll be talking about the principles and the guidelines of delegation. Okay. Now, before you delegate, there are certain things that are supposed to take into consideration. You must know, one, your own scope of practice. So what does this always take you back? It takes you back to the elements of delegation. It takes you back to the anatomy of delegation, which I've said are, okay, which is authority, responsibility, accountability. Okay, so your own scope of practice, if you are a clinician, it is well spelled in the Health Professions Council of Zambia, as an example. All right. If you are a nurse, it is well aligned by the General Nursing Council of Zambia, General Nursing, the General Nursing and Midwifery Council of Zambia. All right, that's where the scope of practice. So, scope of practice is well defined, and you need to know it. You need to understand it. You need to interpret it. Okay. Then. Under the scope, you are trying to look at what can and cannot be delegated. So first you understand your own scope of practice. You also understand the scope of practice to a person that you want to delegate to. Who can you delegate to? You understand? Are you allowed to delegate? Okay. So clinician scope of practice and guideline for interpretation is very important. You need to understand, to interpret, understand the scope of practice, what it means, where should you end, so that you know what you can share, because you're not sharing someone's responsibilities, you are sharing your own responsibilities within your scope of practice. Okay. Delegation decision-making processes. That's very important to understand the decision-making process also. Okay. So once you understand the practice, you understand clinical practice very well, you'll find that you have to know the decision-making processes, who's supposed to make a decision here. So you may not delegate something that should be decided by the district health director, and you say, I think you can do, and yet that's a task for the district health director. Okay, and you are working at the clinical level 1 hospital. So you have really to know also the legal framework, the hierarchy, the organogram. That's very important. It will also guide you as you understand the decision-making process. Remember, ignorance is not a defense in the court of law. No, I did not know that I'm supposed to do this. I did not know that I'm not supposed to do that. Ignorance is not a defense in the court of law. That is very important to remember. Now, let's look at the principles to facilitate delegation or that facilitate delegation. Usually, there are two major principles, and these principles actually are derived from the 5 rights. Okay. So the principle number 1 is the scalar principle. So the scalar principle enforces the clear line of authority, enabling workers to understand number 1, who they can delegate, number 2, who can delegate, to whom they can be accountable. Okay, so all these are taking back to the 5 rights. The second principle is the unit of command. Okay, so it emphasizes that each person should report only to one supervisor. Remember, when we go to the aspect of the anatomy of delegation: authority, responsibility, accountability. All right. So these are the principle that facilitate delegation. So you need to know the scalar principle, you need to know the unit of command. And I'm sure those who have been following, you can see all the lectures, okay, that we have talked about leadership, management, even these principles of management. All right. So delegation, 2 major principles: scalar principle, unit of command. And these principles are derived from the 5 rights which we have discussed. Guidelines for effective delegation. These are the steps now. Okay, so you find that for you to really understand the guidelines, you need to understand the aspect of the 5 rights. You need to understand the aspect of the anatomy of delegation. You need to understand the principles, so that you're now able to follow and apply the guidelines effectively. Let's look at the guidelines. Number 1, be clear about what is to be delegated. Okay, you don't just delegate what you are not sure. Don't just share a task that you do not know. Maybe it is only you can do it, and because you are not so much clear, and then of course you not even get the clear results. You not even have the clear expectations. Select the best person. Okay, who should do this task? Okay, among these, who is much responsible? Okay, explain to others that you have delegated work to whom. Okay, so you have to explain to others that you have delegated work. Okay, to whom we should take it. That brings teamwork. Don't just on a, "Oh, okay, I think in the morning I'm not coming. Can you be in the office and do that?" It's supposed to be formal, generate an internal memo. Even the members should know to say, okay, this is the one that has been delegated. It's supposed to be very formal, straightforward, and very comprehensive. Okay. Otherwise, you may find that the one you delegated, nobody knew to say, no, I never knew. Where do I know? How do I know that you are the one that you are now supervising me? You see the point. So you have to ensure that you explain to others. And then don't interfere unless asked to, but be available for assistance, for advice, or assistance. So when you delegate, you do not just need to come in like, again, you are the one. Then you have not delegated. If you delegate, you share the work to ensure that actually you allow, you permit that subordinate to perform that work within the scope of work that you have assigned to do. Okay. Give support as needed. It's not an aspect now to intimidate. We tell you, as we are well trained, you know that kind of experience, you see what you can't even, you don't even know how to hold a camera, come. That's why I don't allow you to touch my patients, you have to give support as needed so that actually you are in the aspect of training, in the aspect of mentorship. Okay. You prepare your subordinates. Give as much as information as you can for them to understand the task in order them to carry out delegation effectively. That is very, 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 very important. Now, delegation is inappropriate when there are certain things being done. Okay, very important. At what point would we say delegation is not appropriate? No, this is inappropriate delegation. Okay. The tasks that falls outside the scope of practice of the individual to whom the task could be delegated. Okay. So you know that this personnel, I want to share this task, actually does not have a scope of practice for ordering investigation and interpreting. And you just say, okay, you can see this patient, and you know that what needs to be done in that patient actually is outside the scope of that subordinate. Then that delegation is inappropriate. And when delegation is inappropriate, you receive inappropriate results. When it also requires independent, specialized clinical knowledge and judgment. Let's say you are a clinical officer of ophthalmology and you want to delegate to a general clinical officer who has just graduated, okay, to do cataract surgery to 5 patients that booked. It's inappropriate. All right. So if it requires that specialized knowledge, you cannot delegate it, please. Okay. That's very important. If it falls within job description and role of a clinician, delegating the task could be role that role. So when we are delegating, we don't delegate on what are the routine work. That's not delegation. That's actually what they are doing on a daily basis. So delegation is added responsibility. That's what should be understood. Not within the responsibility. That's not delegation. Okay. Hope I'm making it easier. Now, barriers of delegation. That is very, very important. Barriers of delegation. What are the barriers of delegation? Number 1, barriers are categorized into 2. It's either the managers, they are failing to delegate, or they are reluctant to delegate duties, or the delegatees, the subordinates, are actually refusing. Everyone is refusing to accept the responsibility. So those are the barriers. So we'll discuss barriers in two forms. So we'll begin with the managers first. Okay. So number one, why do managers fail to delegate? This also is very, very important for the exam. Okay. Insecurity. Fear that one's weakness would be exposed. Maybe there are certain things that you do in the office, certain things that you do in your area of duties, and maybe you are scared. Okay? If I bring someone to come and act this one, they may know what I do. They may identify because maybe you have been hiding, or you are weak. There are a lot of things that actually you have failed to accomplish. Or maybe insecurity also, you may fear that maybe I may lose my job. Okay? Because maybe I may lose respect. I may lose recognition. Maybe the one that comes in to act actually do better than me. You get the point. So there's that insecurity. And then these managers, they will state or fail to delegate the duties. Loss of power also, they are fearing to say, no, but if I give this responsibility, I share this authority, it means now what am I going to remain with? I'll just be like an ordinary person. I'm going just to be an ordinary clinician. There will be no respect for me. So I'll lose power. And these are the reasons managers actually fails to delegate. The other one is lack of confidence in subordinates. These new graduates, I don't trust them. Can they perform a good cesarean section? Can they really see my patients very well in my absence? No. Because each time I'm out, they call me. No, please, there's an emergency. What can we do? Can you come? I can't even give satellite supervision. So there's lack of confidence in subordinates. Then there is also unwillingness in giving up certain duties. Okay. No, I cannot share this. I'm just the only one who's supposed to know this in this hospital. I don't want to share all these things. So I'm just not willing. It's not in me. So I'll not delegate. Okay. Lack of ability to delegate because I do not know. Remember, before delegation, I've not understood the 5 rights. So even I do not know when to delegate and when not to delegate. So I don't know. I don't have that ability. So I'll not delegate. I'll end up just continue doing all the tasks. Okay. Now, the aspect of the managers, there are certainly also things that they say, me, I will not like. For example, they are not willing on a point, like they are not willing to delegate. Okay, they will make, you say, they will make mistakes. I'm the one responsible after all. I'm aware of the elements of delegation. So when they make mistakes, I'm the one responsible. So I don't want to be responsible over the mistakes that to be made by these subordinates, So I will not. Or I will have no job. I will not delegate. Or I can do better myself. This I cannot do well. So it's all I can do better myself. Better, I do it. Okay? So it will take time as long as to show them what to do, how to do it. Better I do myself. And what am I trying to refer here? This manager is remembering the tape, the teaching, okay, the assessment, the planning, the evaluation. It takes time. Okay. So for you have to explain, and this person maybe has not done it and wants to understand, ask you a question. So you have to take a session and sessions to ensure that they have really understood. So that time, think, this time that I'm wasting, training, why can't I just do it myself? And these are the reasons why they will not want to delegate these managers, right? Or if I give them authority, I may lose my authority, So they will not do that. Or I can't take their work and be sure it is right. So I cannot take their work, and be sure it is right. Because whatever they do, I know maybe I don't trust them, I don't have trust. So I'm not sure if I'll get the exact results. So I better just do it myself. Or maybe I'm seeing them to be very busy, however, I'm seeing these guys are too busy, the OPD are full, I can see queues. I think they are too busy. Let me just continue. I will do it myself. So all these are the reasons. Okay, hope you are enjoying health system management made it simple. I don't want to give up my work because I enjoy it, This is my calling actually. I enjoy. I don't complain. I come here in the hospital, do the ward rounds, I don't complain. I can even, do lunchtime, see patients at lunch. It's me, It's my calling. I enjoy it. So I'll do it. I'll do it, So that is what is important to do. I don't know how to delegate. Where do I begin from? Hey, I've never delegated before. All the time I've been doing it and I've been doing it well. So that is then the other things, maybe once you tried to delegate and things were very bad. You delegated to see, please, you're the one who's going to carry out the labor ward, please, and it was a mess. All the patients that day, in the labor ward, PPH was there. So, the tissue, the veins, were tissued, cannulations. It was a mess. So, whenever I delegate these people, they mess up. So, why should I continue to delegate? So, I'll continue to do it myself. So, these are the reasons. So, there's so many reasons, and these are the questions that actually expect in the exam. So, I hope I'm trying to provide you, making it ready for you to go into clinical practice as well as to prepare for your intermediate examination. Now, what's another angle, another coin, why subordinate may refuse to be delegated to? Okay, what could be the reasons? Number one, fear of criticism or risk of dismissal when mistakes are made keeps people away from added responsibility. So I don't want to be criticized, No, he's the one who was on duty. He's the one that they tasked him, see what he's doing. He knows nothing. Look at it. Oh, I may risk my job. So better I keep my job. I'm comfortable just to work within my job description. Okay. Yeah. The lack of incentives for assuming responsibility. Actually, I'm working for him. My salary is the same. No, better I just stick to my job description. And these are the reasons the subordinates may refuse to be delegated. No desire for extra work. No. Me, I have to do this work. Once I'm done, I have to go home. Okay. And do my other businesses. So they will refuse. Okay. They will not be willing to be delegated to. Lack of confidence on one's part may make a person less inclined in assuming extra responsibility. So I don't have confidence. I cannot do this alone unless we are together. No, I can't do unless the boss is there. So, there is that kind of scenario. And summary now. What are we saying on the summary? we have said what delegation is. Delegation, we define it actually the transfer of responsibility to a person who is competent to complete your task. Now, and we said what delegation is. We said delegation is a continuous process. It's a two-way relationship between a delegator and a delegatee, giving authority to a subordinate, letting a subordinate to take decision, letting subordinate use personal initiative, permitting subordinate to control their own work environment, encourage initiative and teamwork, giving coaching, and this is what delegation is. And we've covered to say what delegation is not. And something we do only once is not delegation. We said it's a process, and take decision for subordinates is not delegation. Distributing workloads only without mentorship, without guidance, without assistance, that's not delegation. Controlling subordinates and their way of working, that's not delegation. Passing one's responsibility onto others, that's not delegation. Directing, that's not delegation. Okay? Dumping your work to others, that is not delegation. Wow! Hope you have enjoyed. That marks our end of lecture for today. So please, now we are going to a problem-based learning. We want now to see if we have understood. Don't run away. We have now a problem-based learning. Okay, let's see. Mr. Kulofwa is a health center in charge at Muchinka Rural Health Center. Among his duties, Mr. Kulofwa screens patients, writes reports, conducts meetings, orients all new staff, makes sure the clinic and its surroundings are clean, and oversees all 50 health center staff, who include cleaners, guards, nurses, clinical officers, pharmacy technologists, environmental health officers or technologists, and medical laboratory technologists. Okay. Mr. Cloffers in recent past complained about of work he has to do, but has vowed not to delegate any of his duties to his subordinate staff because he does not know how to go about it, and that there is no reason he should do so. Okay. So we have seen Mr. Clover here, okay, is in charge. So Mr. Clover is a manager at Muchinka Rural Health Center. Okay, and we can see the duties of Mr. Clover. Okay, he's doing all this. He writes reports. You know what reports are all about. He conducts all the meetings. He orients all the new staff. Very, very, very active, And he makes sure, the clinic and its surrounding are clean. And look at the number that is overseeing. 50 health center staff. Okay. Now, as in recent, he has complained about of what? Of work he has to do. Meaning, Mr. Clover now, he has no time. And you know what it means in the real aspect of life here. Mr. Clover has no even time for his family because he goes home, he knocks off late, he's not resting. So meaning that there are a lot of things that are powers. Okay. But he has vowed not to delegate any of his duties to subordinate staff because he does not know. Okay, because he does not know how to go about it. And he has seen no reason. Why? He has not seen no reason because he's able to do it. He's maintaining, make sure that the clinic and its surrounding are clean. That's why he has not seen reason. So, how would you advise Mr. Clover when he consulted you on this? So now imagine you are also a manager at another facility. Then he is complaining to you, but you, my friend, how are you managing again? See, you are less stressed, your office is cleared up, but things for you are working. And how are you managing? you know how are you managing? Then he gives you a scenario, he's complaining to you. Sometimes there are meetings, and you are at lunch and you are sharing now work experiences. So Mr. Clover is now sharing. So first question, what would be your what would you advise Mr. Clover as he consults you on A, the reasons why it is important for Mr. Clover to delegate? Okay. Number B, the steps that Mr. Clover can take to delegate. C, the reasons why managers are reluctant to delegate. It's you now. You're looking at why is Mr. Clover actually reluctant to delegate. So from there, I'm sure you are able now to identify. Okay, I'm sure from there you are able to identify, to look at what is actually happening on the aspect of Mr. Clover. Okay, so number one, what are we trying to look at? Okay, let's look at A, G and E. Okay, I've just looked at advantages. I will come and explain. Okay, so now let's try to now understand what are we looking at. If we say the reasons why it is important for Mr. Clover to delegate, what are we being asked to do here? Let us try to now find out so that we can do what? We can discuss effectively. What are we being asked to do if we were to look at this situation for Mr. Clover? Okay, so number one, let me try to write now something here. Okay, let me put up the pen just to look at the aspect of what are we trying to look at number A. Okay, let me put up the pen there. What are we trying to look at number A? So the question on number A is looking at the importance, okay, of delegation. Number two, the guidelines. Very simple, of delegation. Number three, barriers of delegation. For managers. This is what we are looking at. Hope now you are smiling and you have even known the answers now. Okay. And we'll look at what of the advantages. The advantages actually are equally same with the importance of delegation. So sometimes they may ask you in the exam advantages. Do not get confused because they are all the benefits. Sometimes they may ask what are the benefits of delegation. Okay? Yes. So the benefits of delegation is the importance of delegation. They are same as advantages or benefits. Disadvantages, actually, these are the barriers. This is how simple it is. That's why you can score, okay, a very good mark. These are high yield revision for health system management for those who are preparing. Let's now begin one by one. We have now seen, let's begin with A. Okay, so the reasons why it is important for Mr. Clover to delegate. We're talking about the importance of what? Delegation. What is the importance of delegation? So we're talking about the importance of delegation or the benefits of delegation. So number one, it saves you time to do other duties and you look ahead. So from here, it saves you. Why is it important? Looking at it saves you. Thinking about the importance of delegation. So it saves you time to do other duties and you look ahead. Number two, the function that you have delegated gets individual and constant attention. It speeds up decision making, provides a form of on-job training, which I've explained. It's a motivating factor. It facilitates staff development. It causes subordination to accept responsibility. It keeps things going when you are not around. It helps to give you the satisfying experience of watching your subordinates develop. And you get the marks. So if they have told you 5, pick up 5. Okay. And you can even add the explanation the way I was adding explanation and you outline like that. You will not miss any mark and it will be there for you. So we have answered A. Let's go to B. What are the steps that Mr. Clover can take to delegate? Okay. Number one, what are we being asked for here? We talked about these are what? These are guidelines. These are guidelines of delegations. Okay. So when we talk about the guidelines, we always remember what? The 5 rights and the principles. Okay. And what are those principles we talked about? What are those 5 rights that we're able to remember? What are those 5 rights? We have the right task where you determine, okay, what to delegate. That's the right task. Number 2, you have the right circumstance. Okay, have a genuine reason. Number 3, you choose the correct person to delegate. That's the right person. And number 4, you look at the right direction communication. You classify the desired results. And the 5th right, we talked about monitoring progress. That is the right supervision and the evaluation. And the principles, we talked about the Scala principle, okay, so that you're able to know who to delegate, who can we delegate, and who can we delegate to, who can be delegated, and to understand the scope of practice. And then the also unit of command, to look at the aspect of supervision. These are the principles. Now, these are what guide gives you the guidelines. Now, what are these guidelines? These are the ones that we discussed. Number 1, be clear about what is to be delegated. Okay. Number 2, select the best person. Number 3, Explain to others that you have delegated work and to whom is responsible given the duties. Don't interfere unless asked to, but be available for advice. Give support as needed. You prepare subordinates. Give as much as information as you can for them to understand the task in order them to carry out delegation effectively. So here you still remember the what? The table. Okay. So we said that is teaching or training, assessment, planning, evaluation. That's what we mean on point 6. And these are the steps that you have to write and you get your marks. Very easy for you to get a distinction in health system management. Okay. The reasons why managers are reluctant. In this aspect, we're talking about Mr. Clover. Why? Now, you are trying now to think, these are the reasons. Even when you're explaining, you know what Mr. Clover actually is passing through. Why is actually delaying? Okay. Number one is the same question, why do managers fail to delegate duties? Okay, the same question. So it's just insecurity. Fear that one's weakness would be exposed is one of the reasons that you could have been looking at. Number two, it could be loss of power. So there's fear for loss of power. Lack of confidence in subordinates. And this is cited already from the scenario. Okay? Unwillingness in giving up certain duties. Lack of ability to delegate. This is another thing actually. If you follow the scenario, Mr. Clover is not known, so it's lacking the ability to delegate. Okay, and also from the scenario cited already, there is lack of what? Confidence. Okay, so that is what is very, very, very important to take note for Mr. Clover. Okay, what other point? Loss of job. Maybe fail. No, then what would be my my validity, my importance? What would be reason of me being there if everything are able to do? So sometimes there's the loss of fear for loss of what? Job. Fear for loss of job. Okay. Then for D, the one I asked about advantages. In case that's in the exam and they ask you on the advantages, how would you go about it if they ask you on advantages? So number one, advantage is it reduces the workload of the manager. Okay. So that simply means that through delegation, a manager is able to reduce his or her workload by giving subordinates to perform some of the tasks. Okay. Then that will result into reducing the workload. The other advantage is makes work easier because of shared responsibility. So you find that as a manager actually delegates performance of some of or his duties to subordinates, work becomes easier, and work would become difficult if he does not actually delegate like the way Mr. Clover was doing. Started beginning to complain because there's now no time to rest. All things are waiting for him. So it makes work very easy because now you are sharing and those are going to be done, achieved at the desired time frame. Okay. It allows the manager to concentrate on aspects of job which require his or her personal knowledge, experience, and skills. Maybe, as a clinical officer, you have to share certain tasks to community health assistants, to the nurses, and others, and concentrate on specific clinical duties that's supposed to give as a clinician. Okay. It promotes staff growth and development, and it makes everyone to gain experience, everyone to learn. These are the advantages that are there. So you find that that's one of the key area, because it provides opportunity to the subordinates as well to acquire knowledge, skills, experience, and contributing staff development in that department, in that hospital, in the Ministry of Health, and other organization that you may be working from. So that is very, very, very important. Let's look at question E. What are the disadvantages? Okay, what are the disadvantages? So number one, it is time consuming. Whenever we talk about time consuming, because actually it requires considerable amount of time, as in some cases managers may have to train staff to handle delegated tasks, and when you look at that, actually it is always to remember, when you talk about time consuming, always you should remember what? You should remember teaching, assessment, planning, evaluation. So it's a process. Okay. So it's not so easy. So it is time consuming. As a result, this is what others leads them not to actually to dedicate. So if we're looking at disadvantages, we can answer in this way, but it's one and the same that we're talking about. Okay. And depending on the task, the training may take from a few minutes to several weeks. So that's what it means. Okay. So time consuming. So since it is time consuming, I'll just do it myself. For me to start training, showing all these things, explaining, I would have finished. So those are the advantages of dedication. It may also result in low quality work. Okay. So managers need to delegate tasks that they have performed for a considerable period of time, and they have allowed the subordinates that at least they have gained experience and expertise, okay, in performing good quality work. That's why it's time consuming. So you find that you cannot just show someone in a minute just explaining. You discover that actually there will be low quality work. So that's one of the disadvantage of the delegation. But the delegation is very good. It is a very genuine delegation. It is a very comprehensive delegation. You may have quite work, but it's time consuming. Okay, so these are the advantages. It may lead to failure. Okay, actually it's not all there of task accomplishment. Okay, so it may lead to failure of task accomplishment. Simply means that there are some tasks that require certain amount of authority to accomplish. Okay, so this authority may come in the form of being able to secure funds or get cooperation of people in other departments. So that may be very difficult. And if the task is given to an employee who lacks proper authority to secure those necessary resources, delegation is likely to fail. So you may find that actually you may not get the desired results. That's one of the disadvantage. So here it is not, it is off. Okay. The other one, it may result in loss of enjoyment for doing some of the tasks. I enjoy screening. I don't want to miss a diagnosis. I enjoy being on a OT table, in operating table. I enjoy that. It's part of me, my calling. Now, it may result in loss of enjoyment because I've stopped now doing those things that I used to enjoy, so it may result into loss of enjoyment. So you find that the managers who truly love their work find that delegation task actually goes into the hands of others. They may lose that enjoyment that they used to have. And the other disadvantage of delegation, it may result in loss of control over critical tasks. Okay, so one of the disadvantage is that you lose control. Okay, should only be done by manager alone. So here you remember, go back to the anatomy, to the elements of delegation. Okay, so remember we talked about the authority, the responsibility, accountability. So the authority, that's power, right to give orders. Responsibility, you have the duty, okay, an obligation to perform the duty. And authority, accountability, you're accountable, you are answerable for the job outcome. So these are the key things. Examples may include performance, side reviews, as well as training, reprimanding, and terminating employees. So that will result into loss of control over critical tasks. Thank you very much. I hope you have enjoyed. It has been a long lecture and you have covered. I'm sure you are able to answer any question that may come on delegation in your exam. So for questions, please subscribe. Okay? Subscribe and join on the platform. There is a quiz preparing you the multiple choice, the matching questions, the true or false, and main scenarios that are talking about delegation, so that you do not miss any question when time for the exam comes. Remember, we don't study hard, but we study in a smart way. Thank you very much. Stay blessed.